Hi, I'm David Almasi with the National Center for Public Policy Research, spelled ALMASI. I want to ask you about Merck's membership in and funding of a controversial group that wants to keep our company from making a profit while also putting patients at risk. According to the website of the Institute for Clinical and Economic Review, ICER, Merck currently helps pay for the annual ICER Policy Summit, webinars, and other programming. But a group of concerned oncologists have claimed that ICER recommendations about drug pricing are based on research that is unscientific, biased, and non-comprehensive. Those oncologists also expressed concern that ICER has relied on largely inaccurate assumptions to demand lower drug prices. Additionally, Amgen, not a member or a funder of ICER, charged ICER as too focused on drug prices as the main determinant of health system value. As these concerns were being aired, ICER was calling for Merck's Keytruda drug to be discounted by at least 20%, possibly up to 60%. ICER was founded by Dr. Stephen Pearson. He came to our shores after working with the National Institute for Health and Care Excellence in the United Kingdom, commonly known as NICE. NICE's not-so-nice recommendations are a reason why hundreds of thousands of Britons are on waiting lists for basic diagnostics tests, and thousands of operations are regularly canceled. The Guardian recently reported that people who are losing their sight are being forced to wait for months before having eye cataracts removed because of imposed restrictions on patients' access to cataract surgery in more than half of England, thanks to NICE. NICE's disastrous cost-effectiveness policies are what Dr. Pearson and ICER are now trying to replicate here. Former U.S. Representative Tony Coelho, a primary author and sponsor of the Americans with Disabilities Act, explained the real-world unfairness of this scheme. He wrote, "This type of cost-effectiveness analysis discriminates against people with disabilities and other vulnerable groups like the elderly because it assigns higher value to people in perfect health than people in less than perfect health." ICER is working with CVS on cost-effectiveness strategies. CVS CEO Larry Merlo told my colleague it's about getting suitable price points for drugs. That means more of what happened with Keytruda at the expense of patient outcomes. When I brought this up with Johnson & Johnson CEO Alex Gorsky, he appeared disturbed about ICER's agenda. I'm hoping he will reevaluate his company's relationship with ICER. So now I'll ask you the same question that I asked Mr. Gorsky. Can you explain how funding ICER benefits Merck?
Thank you very much for your question. Before I get to your direct question, I just want to reassure you that this company is extremely committed to two things. The first of which is, you heard Dr. Perlmutter describe the unprecedented progress we're making in our labs in areas like oncology. The second area is meaningful access to patients today, as well as making sure that we have the investments necessary to find the medicines that tomorrow's patients will need. So let me be abundantly clear. We are committed to ensuring that we have a healthcare system that adequately rewards important innovations. Now, to get to your question, I think it's a philosophical question in terms of whether our presence in that organization is the best way to influence how this kind of cost-effectiveness analysis gets done over time. So our choices are to absent ourselves from the whole discussion and hope that it turns out in a positive way, because let's be very clear, to the extent that reimbursement authorities around the world listen to ICER, they're not going to listen or not listen because we're there or not there. So we have a choice to make here, whether we should show up and try to influence the work that's being done in ICER. And I would say that we share many of your concerns about the methodology in which drugs are being evaluated. We completely share them. But the philosophical question is whether or not walking out on the discussions puts us in a better position in the long term to achieve our mission, or whether or not being in the room and having our own health economics experts participate in those discussions is likely to lead to a better outcome. But thank you for your question.